I probably have a hard collar on.
The blood and bruises are caused by makeup, not trauma. But to these doctors, nurses, and residents, this simulated disaster casualty is as close to the real thing as they might ever get. Each year, some 2,000 healthcare professionals at this Boston Simulation Center prepare for disaster injuries they hope they'll never have to treat.
Disaster planning has changed substantially since 9/11 and Hurricane Katrina. We as a society have realized the importance of being prepared for events that could happen here within the United States.
It looks like the bleeding's coming from the backside of the cava here, but I can't be sure.
Disaster simulation is a rising trend here, with some 30% more emergency room physicians, surgeons, anesthesiologists, anesthesiology residents, and nurses being trained each year. They're operating on a mannequin while their actions and audio are taped through a two-way mirror.
Everyone hopes that we never face a disaster like Katrina again, but I think that we all expect that something somewhere will happen again. What it will be is totally unpredictable, and we must be prepared for that unpredictability.
If there's a point where you have a question you need to ask, please do so.
Physicians train residents here, and then, just like in real life, all the participants get thrown a curveball.
You know he has a penicillin allergy.
Meanwhile, many physicians have joined real-life response teams, which are ready to be deployed to the site of a disaster anywhere, anytime.
These people are sick, they're separated, they're injured, they're destitute to begin with, and to be able to be right there with them and lay hands on was, it was both at the same time a gut-wrenching experience and a heartwarming experience.
Indeed, experts stress that responders' jobs will be easier if individuals and families are prepared too. Have a disaster kit in your home that includes food, water, medicine, and other supplies. Have plans in place in case your family becomes separated, where to meet, and someone to call who is outside the immediate area. Also have important documents accessible. For Doctors' Day this year, the American Society of Anesthesiologists recommends that each person have a copy of his or her medical records on hand.
After Katrina, I know anesthesiologists in other cities who were faced with treating plane loads of patients who had absolutely no medical history and were unable to give a medical history. It was very difficult to treat those patients, and there's a lot of effort now to facilitate the transfer of this important medical information.
Well done. All right, so let's go back to the conference room and let's review what we've done here.
And as anesthesiologists, this is a great way to train on a regular basis so that you can discuss in a tabletop setting exactly how you would treat a patient that may present to you with chemical injury, nuclear weapon injury, biological injury.
I think we learned that we need to be prepared for things that we cannot expect.
This is Bob Hill.
See what was going on there. Maybe we can reset this again.